Good morning, Doc. My name is Kuya Morales Hermosa, Level 2 student nurse of Southwestern University of Lima. And for today, I will be demonstrating the dwelling of the catheter insertion. So the first thing that we're going to do is we're going to review the doctor's order. Then we're going to identify our patient. Then we're going to assess for the allergy of the patient to the latex and the iodine. After that is we are going to explain the procedure to the patient, the type of the catheter, and the purpose of it. Then after that is we're going to perform the hand hygiene. We're going to prepare all the equipment that we're going to use. And then after that is we're going to provide privacy. And then we're going to position our patient in comfortable position. And for the female, we're going to position them in a recumbent position. But if in male, we can do the supine position. And then after that is we're going to place a bath towel. Then we're also going to place a waterproof pad under the patient's feet. And then after that is we're going to check the temperature of the water that we'll be going to use for cranial care. We're going to wear our gloves, clean gloves. Yeah. And then we're going to start washing the perineal area. So we're going to get a SO. Assume that it is already soaked in a water with soap. And we're going to clean first the abdomen or the pubic part of the. Then make sure to discard every after. Then get another to clean the side. Discard. Okay. Discard and then and then after that is we're going to remove our gloves. Then we're going to prepare the materials needed. So we're going to put use a corset and we can get and place and get the. But before that, we're going to ask someone to first open the bag. So assume that it was already a bag and we're going to drop it to the sterile field. Then we're going to also drop. Then make sure to drop it because then this part. Then we're going to ask to get the sensitive sheet using the gel. Make sure not to touch it. Drop it. Get the sterile dressing. Okay, then we're going to wear the sterile gloves. That's it. Then we're going to ask someone to or to open the
Catheter.
but first we're going to place first the cell vessel. Mga placing make sure not too fast. Then we're going to put the insertion. Let's now ask someone to open the polycatheter. And then after is we're going to test the balloon to make sure that it has no problem. We're going to use the PNSS. We're going to withdraw at 10 cc. And then we're going to insert it to the balloon. So, as you can see, the balloon is okay. Then we're going to withdraw it. Make sure to, if how many amount of NSS you have injected, make sure to withdraw the same amount as well. Next is we're going to ask someone to open the iodine first so that we can clean the cranial part of the patient. So if it's illegal, we're going to clean the urethral meatus of female patient, but if in male patient, we're going to clean the penis glands of the patient. So make sure. Then we'll get here. Then ask someone to get the tent. Then we're going to lubricate our catheter. So in female, we're going to use the size of the catheter at 2.5 to 5 centimeter, and if it's male, we're going to use 12.5 to 17.5.
Not the size.
The
But
The-
you will
Lubricate.
lubricate around or about 2.5. Not the
We're going
size.
to gently insert it, and then we're going to ask our patient to take a deep breath as we insert it gently. And hold. And gently. And if we already see there's a buccal urine, we need to get the ivory bag. Then we're going to inject at 10 cc again to the catheter. And after that, if after this, we put the cylinder back over. Then we're going to tug it, making sure that we're on the right track. If you felt any resistance, it means you're needing that. Then after that is we're going to secure the catheter at the hips of the patient. And after that is we're going to assess and document the character, the color, and the amount of the urine. So now we're going to proceed in removing the catheter. So the first thing we're going to do is we're going to withdraw again the same amount of the NSF that we have injected. And when removing it, we're going to insert our patient again to take a deep breath. Then remove and then pumunta na pa. Start this, and then we're going to remove our gloves and remove all the equipment that we have used, and then perform the perform that will be all.